Hello guys, this is Dr. D, and today we'll talk about the white blood cells or the leukocytes. We are continuing with hemopoiesis. Again, what is hemopoiesis? Formation of the blood cells. In this case, today we are talking about the white blood cells, remember? So here the hemocytoblasts are going to form what? The myeloid or the lymphoid. And the myeloid has the choice of forming RBC along with platelets, along with the different types of white blood cells or lymphoid cells which form the lymph cells. All right. But what we do not know is, based on colony stimulating factors and interleukins, in response to this, the stem cell will produce that particular type of white blood cell. We'll talk about this in just a few minutes, all right? So here there are 5 types of white blood cells. We'll talk about each of them in the next slide. All right. So first category are the granulocytes. Why granulocytes? Because they have granules that can be seen. All right. So here are the first category are the neutrophils, basophils, and eosinophils. Neutrophils ones are the most common. All right. Not that I'll ever ask you this percentage, but definitely you need to know that of the white blood cell composition, the neutrophils are the most common. So here, how do you recognize this neutrophil? The neutrophil has a polymorphonuclear or multi-lobed nucleus, okay? Many lobes of the nucleus. Now, these are the first at the infection site. And what is their function? Phagocytize bacteria, fungus, virus, as long as the pathogen or the invader is small. They are the ones that will phagocytize it. They also produce prostaglandin, which will increase the blood vessel permeability. I will tell you why. That's important, okay? Basophils. The basophils have deep blue granules, and what's the beauty is, can you see the nucleus in this case? The answer is no. So it is so granular that it looks like a mulberry, a blackberry, okay? So many granules, you cannot see the nucleus. Now, what's the best part is they are non-phagocytic. But what is their function? Their function is to produce what? Histamine and heparin. Histamine promotes inflammation. What is the inflammation? Swelling. The cells are going to swell. They are going to be hot. They're going to be inflamed. We'll talk about inflammation in the next slide. And they produce heparin, which inhibits blood clotting. Notice their percentage, less than 1% of the white blood cells. Now, as I tell you that Mother Nature has created the most advanced being, and that's you and me, right? So we have everything in our body, there's a reason. So if anybody were to ask you, why are the basophils less than 1%? The answer is obvious. Histamine promotes what? Inflammation. Would you want excessive amount of basophil? Answer is what? No. Excuse me. Eosinophil. Eosinophil are coarse red granules. Excuse me. Uniform in size. Look at the nucleus, bilobed nucleus. And what do they attack? Objects coated with antibodies, or they are small multicellular forms. Multicellular forms like worms, eggs, etc. All right, so they form 1 to 3%. So which is the most common granulocyte? What will you say? Neutrophil. All right, which one is the one that's responsible for phagocytizing multi-celled pathogens? And you will say eosinophil. So now let's look at the A granule. A means what? No. Granules. Now that's not true. They have very small granules which are very small and few. So when you look at these cells, their cytoplasm will appear clear. All right. Monocytes are the largest blood cells. They are 2 or 3 times diameter of RBC. So they have a oval or a kidney shaped nucleus. That's how you recognize them. All right. What do? They phagocytize bacteria, dead cells, and debris. They form 3 to 9%. The lymphocytes are very, very small, very similar to size in RBC. But how do you recognize them? The nucleus is going to be large. Only a sliver of the cytoplasm you can see. All right. They form about 25 to 33%. And these are the ones that provide specific immunity. We'll talk about that in an entire new presentation. All right. So again, let's go back to this question that you had. Now, each, as you can see, has a different function, right? Oh, one quick comment. When monocytes leave the blood vessel and go to the tissue spaces, now they have a different name, and the name is macrophage. Macro means what? Big. Or phage. All right, they are phagocytic. All right, so here you're seeing that each of these white blood cells have a specific function. So the question is, how does the hemocytoblast know which cell to form? The answer is obvious. What is the need of the body at that time? If you have a worm infestation, obviously you are going to produce what? Eosinophil. And at that time, colony stimulating factor will be produced, which will stimulate the formation of hemocytoblast and multiply and mature into what? Eosinophil. All right. All right, so response to tissue damage. Now, the white blood cells are very unique, of course, as you know, that they have a nucleus and they have organelles, right? So they differ from RBC. RBC also has a pigment. Do they have a pigment? No, they don't have a pigment. All right, so here they can migrate out of bloodstream, and this is called diapedesis. 2, they are able to have a gliding motion, which is called amoeboid movement in the tissue. So in the tissues, they glide through amoeboid movement. And how do they know where to go? Because they're attracted to chemical stimulus, and this is called what? Positive chemotaxis. A good example, like, aren't you attracted to a very beautiful smell? Somebody is wearing a nice perfume and you'll say, wow, that smells so good, and you'll walk towards it, right? When you're hungry and there's pizza, you will walk towards that, right? That is called what? Taxa means movement. Chemo means in response to the movement. But because you're going towards that, it's called positive chemotaxis. Movement to a chemical positively. All right. So white blood cells are able to do these 3 things, which a red blood cell is not able to do. Do you see the diapedesis? The leukocytes are leaking out. Will a red blood cell be able to leak out? Answer is absolutely not. If red blood cells start leaking out, then it is called hemorrhaging, right? All right, what's inflammation? We talked about basophils producing histamine, which produces inflammation. So inflammation is a defense reaction. What is the objective? To localize and eradicate the irritant. So it involves dilation of the capillaries. Of course, you want more blood flow. So you want some changes. What are the changes? The changes are that there'll be changes in the blood plasma. Of course, you want more and more proteins. So there will be some changes in the plasma. And the leukocytes leak out. What's that leaking out called? Diapedesis. So if you click on this, you will see it in action. But just that's not going to work on this slide. What are the leukocytes disorder? There are 2 leukocytes disorder. There are many, but we'll talk about only 2. Leukemia and infectious mononucleosis, or the kissing disease. So leukemia, what happens is that the leukocytes will proliferate. Look what I'm saying, out of control. Now you're saying, oh, that's good, I have more leukocytes. No. Remain unspecialized. So if you go on here, and if I show you this slide and ask you to recognize, you say, oh, this is an eosinophil. It has bilobed nucleus, right? So what I'm saying, unspecialized, means you will have a bunch of white blood cells that are useless because they're not specialized to do any function. All right. So here, This is what is the typical symptom? Acute and chronic anemia, but you'll have bleeding problems, bone pain, weight loss and fever. Now, weight loss and fever, just because you have weight loss and fever, you don't want to tell anybody you have leukemia. Of course, to determine a leukemia, you absolutely have to go to a doctor and get all the tests done. But the typical symptom will be anemia and bleeding, okay, and bone pain. Infectious mononucleosis is a kissing disease, and it is caused by this virus, Epstein-Barr virus. Got to know it, okay? So results in excessive number of what? Agranulocytes. Notice the difference. Symptoms are low-grade fever, sore throat, body ache, malaise. I will tell you one thing. That is, you get very, very tired. It's very, the person who's suffering from mononucleosis will always have a low-grade fever and will always be tired. All right. So if you have any of these symptoms, you should definitely go to the medical doctor. All right. With this, we come to the end of our presentation for white blood cells. If there are, let me see. All right. If there are questions or concerns, please contact me. I thank you for listening to me. You have a good day.